Good evening, everybody. Look at this list of people we got with us tonight. This is amazing. I'm Elizabeth Ford. I'm the office manager for Spinal Diagnostics, and welcome to the Advancement in the Treatment of Chronic Pain webinar. This is being hosted by Spinal Diagnostics in partnership with Boston Scientific, and our speaker tonight is Dr. Jason Anderson. I want to take a few moments to thank you for being here. I know it's snowy, the weather's a little crazy, so we do appreciate the time that you're taking to be with us on this evening. During the presentation, please feel free to submit any questions that you have in the Q&A section at the bottom of the webinar. If you submit in there, it will remain anonymous. We will have time at the end of the webinar to go over as many questions as we possibly can. For those questions that we can't answer, we will try to get in contact with you after the webinar tomorrow or later this week. A recording of this webinar, if you can't stay for the whole thing, or if you know somebody that might have been interested in watching it but wasn't able to attend tonight, we will post it on our website. It takes about a week to get it on there, but it's under the webinars tab on spinaldx.com. Now that we've covered all those details, I'm happy to announce and introduce Dr. Anderson for this webinar. Take it away.
Thanks, Liz. And I want to thank everybody for attending tonight, as well as I want to thank the team at Boston Scientific and Lee and her team for helping to put this together, and then also Liz and our staff for getting the word out tonight. It looks very well attended. Next slide. So tonight we're going to talk about treatments for chronic pain. For those of you that are dealing with pain, you may have seen some of these treatments. This may be the first time you've even heard about them. So we're going to go through a few different treatment options that you may or may not already know about, and hopefully we all learn something. So first, we're going to learn about chronic pain treatment options, see why one option may be better for you than a different one. And then we can also have some things that you might want to discuss with us further at your next office visit. Next slide.
And one moment, Dr. Anderson, would you please try to turn your camera on and off? It looks like we cannot see you, so I just want to make sure we all can see you here.
Strange. You see me now?
I cannot.
Okay. Let's see. Can you see me now?
Yes, that's perfect. Thank you so much. All righty, go ahead.
Okay, next slide, please. Okay, so if you do have pain, you know that it interferes not just with your ability to enjoy life without pain, but it impacts your ability to do things, be productive, and enjoy the simple things, as well as things that you do for pleasure or just normal everyday activities. And I think one point that goes without saying, but people who have pain aren't the only ones impacted. It also impacts their family members or their friends, or because either they're not available, or they're grumpy, or they're sad, or they're having a lot of pain and they're just not able to enjoy activities to the same degree and level that they all know and love them for. So, and then it can also, impact very personal issues like bowel and bladder control or being sexually active. Next slide. So chronic pain patients typically have tried many different options. The first thing, if you say you have pain, that your doctor is probably going to recommend is trying over-the-counter options like Tylenol, ibuprofen, Aleve. If that doesn't take care of your pain, then you're going to probably be offered physical therapy, chiropractic, massage, or acupuncture. If that doesn't work, then you might try some things like TENS, stronger medications. You might try injections. You may go see the spine surgeon. And whether you're a candidate for spine surgery or not, often they want you to have injections first. Many of you may have even had spine surgery and then found that it helped maybe for a temporary period of time, but then the pain's back. And then some people get desperate enough, they may have tried drug pumps, or we call them pain pumps, but pumps with medications put in them. So those were kind of the traditional treatment choices in the past. Next slide. Before we get into some of these other treatment options we're going to discuss further, first, it's important to know that there's a couple different types of pain. When we're evaluating you and asking you questions about your pain, we want to know, is it a mechanical type of pain or is it a neuropathic pain? Mechanical type of pain is going to be there in certain positions or have a trigger, whereas a neuropathic pain is typically going to be there regardless of whatever position you're in. Neuropathic pain symptoms can include numbness, tingling, pins and needles, sharp shooting, stabbing, burning pain. But you can also have that type of pain with mechanical pain. It's just only in certain positions or doing certain movements. Next slide. So today we're going to talk about 3 different treatment options: radiofrequency ablation to start with, then we're going to go to indirect decompression or the Vertiflex device, and then finish with spinal cord stimulation. Next slide. So radiofrequency ablation has probably been around the longest of the 3 that I'm going to discuss. I think when they first discovered electricity and were trying to figure out ways to use it is when I saw the first documented literature regarding it, which goes back into the 1930s, I think. But it hasn't really become more popular until probably 2000s. So radiofrequency ablation is a way to help treat chronic pain, primarily in the back or the neck, related to facet joints. And the facet joints are in the spine. They're off to the side, and they're kind of like the knuckles of the back. They can get enlarged with time, and you can have bone rubbing against bone. And we have a way of basically with radiofrequency ablation of quote unquote burning the little nerves to give you relief for 6 months to 18 months at a time. Now, as it says there, radiofrequency ablation is application of heat to small areas of nerve tissue so that they don't transmit that pain signal anymore. This is a needle type procedure, and we often have to do a couple of sets of diagnostic injections before we just go in there and do this procedure to help confirm that it's actually going to work for you. And the good thing and bad thing about it is your nerves will grow back. So, you know, if it didn't work, they will grow back over the course of time. But this is one case where our body trying to heal itself works against us. So we do the diagnostic procedure first just to make sure that, again, it's the right choice for you. Next slide. Okay, so next we're going to talk about Vertiflex. And one other thing I wanted to say about the radiofrequency ablation, if we can go back, is what I tell patients is sometimes, you know, these joints, they get too many, they're like tires that have had too many miles on them. And now you're starting to run on rims, and you have a sensor that keeps telling you that you're running on rims. Well, you don't really need that sensor to keep telling you that you're going to be running on rims. So this is one way we can kind of turn that signal off so that you don't have the pain associated with that. All right, next slide. All right, and now we're going to talk about the Vertiflex procedure. The little device you see there is called Superion. And next slide. This is for a condition where there's too much narrowing going on in the spinal canal. So symptoms from this are typically what you see with the patient that's bent over while they're walking. They may be using a walker or a cane, or sometimes they're just walking bent over. I've yet to meet a patient that has this condition that wants to walk bent over. The reason they're bending over to walk is because they can make more room in their spinal canal by bending forward. So in this case, these patients have mechanical symptoms in that when they stand and walk, the narrowing gets worse and causes them to want to bend forward to get relief. When they sit down, that's one way of opening the spinal canal, or lean on a shopping cart. So often these patients will have tried a lot of different medications. They'll think they're sometimes going crazy because they'll have sensations on one side one day, and then the other day it'll be on the other side. They may get what we call paresthesias, or weird sensations in their legs from this condition. Sometimes it feels even like hot water or cold water is running down their leg. So it can also just be isolated pain in the back that's worse with standing and walking and starts to go in the buttocks, maybe associated with balance issues. Next slide. So what is lumbar spinal stenosis? Like I alluded to before, it's a condition where gradual narrowing occurs in the spine, either where the nerves are exiting from on the sides or in the central canal, where the nerve roots run. The spinal cord actually ends higher up in the low back, but then continues on as a bunch of nerves through the central canal until it's their respective turns to exit on each side. You can have a kink in the hose effect happen in the spinal canal so that you get a pinching of these nerves, and then that results in the numbness, tingling, weakness, and then pain in one, both legs, or just in the low back. So relief can be experienced, just like I said before, by bending forward or sitting. Next slide. So what we can do for this, the Vertiflex procedure is what I consider an elegant solution to a simple problem. So you have, when you stand or walk, your spine, here's the back of the spine, this is the front of the spine. Your spine is going to go like this and cause more narrowing where the nerves are running. By taking a simple device and putting it between the spinous processes here, you can keep it from getting closer together and keep that space open. I can do this all through a very small incision, about this big. It's a same-day procedure. You go home the same day, usually within an hour or so after the procedure's over. The procedure takes about 45 minutes per level that I do, and I can do 2 levels at one time. It does not require any removal of bone. From a surgeon's perspective, they would consider your back still a virgin spine in this area because we haven't gone any further into the spinal canal. It has a very low risk of complications or infections, although if it did get infected, we'd have to take the device out. One study that they looked at for patients that had this done at 5 years, 90% would do it again. So I've seen similar outcomes in my patients, which is kind of remarkable in medicine. A lot of studies really highlight only what they want you to know about. But I think because this is a simple problem, has a simple solution, the studies have actually been shown to be true. They've been doing this procedure since 2016. And this slide's a little old. It said 10,000 patients treated since 2016. It's got to be much more than that at this point. Next slide. So again, 9 out of 10 patients are satisfied with it. 85% had a drop in their opioid usage. Most of my patients report that they can at least walk longer. That would be kind of a good outcome or a fair outcome. And then, I have some patients that they don't have any symptoms at all anymore, but I've had patients go from only being able to walk for 3 minutes and then walk 30 minutes. So it's been really remarkable, and a very simple treatment, and it's nice and rewarding to see the outcomes. Next slide. All right, so now we're going to talk about spinal cord stimulation. Next slide. So spinal cord stimulation, it's been in use for over 50 years, although I would say in the last decade, the technology has rapidly changed. If you've known anybody that had it in the past, it was good when we had no other treatment option, but there were some issues with it. It wasn't very flexible. For one, it was either you had the device on or it was off. And there were some difficulties with it. In the last decade, there have been a lot more companies doing research into the space, including Boston Scientific, and they've really addressed the option or the issues that came along with spinal cord stimulators in the past. They're very flexible in their treatment options. And Boston Scientific has been the leader in trying to create as much flexibility as possible around this. They've also worked to address issues with lead migration by having a lot more leads and contacts to choose from. And then there's been a lot of advances in the remote controls, the information we can get from the devices on how well it's working. And then the devices are getting smaller. The generators are getting smaller. The batteries are lasting longer. So everything is improving in this space. One thing to know, spinal cord stimulators, it's a non-drug therapy. We don't like long-term opioids for our patients because there's issues that develop around being on opioids for long periods of time, like increased pain or poor pain control when you actually do need it, around like a surgery. So the more that we can get people without a bunch of medications to control their pain, the better off they are. So this is a long-standing treatment option, and sometimes can be used instead of having more surgery, or when surgery is not a good option for a patient due to health reasons. Next slide. So this has been proven to be safe and effective. What they're showing there on the right side is an average pain of 8.6 going down to about 2.98 or about 3 after 2 years. And this is for treatment of low back pain with the Boston Scientific device. Next slide. So, and who can benefit from spinal cord stimulation? This is going to be, instead of the mechanical type of pain that you have with the Vertiflex procedure, this is going to be for somebody who has pain almost all the time. It can be due to diabetes, neuropathic pain, peripheral neuropathy. It could be due to previously having surgery and there's some permanent nerve injury that just didn't get relief. You could have had CRPS, or complex regional pain syndrome, or what was called reflex sympathetic dystrophy. Basically, for patients who are not great surgical candidates, we can try this as well. If they have a lot of pain, especially if it's going down the legs or in the back, and it's not responded to other things like radiofrequency ablation or some other options. Next slide. So now we're going to watch a little video about how spinal cord stimulators work.
If chronic pain is keeping you from the everyday activities you love, you've probably tried a number of treatments to help manage it. Medications, nerve blocks, surgeries, and more. But because we feel pain and respond to treatments in different ways, these therapies may not always provide the long-term relief you're looking for. Spinal cord stimulation, or SCS, is a safe, drug-free, FDA-approved pain management therapy that's used by tens of thousands of people around the world and is clinically proven to help reduce chronic pain. And with Boston Scientific, this treatment can be tailored to your unique needs and preferences. Here's how SCS works. When you feel pain, in your back or leg, for instance, it's because nerves from that part of your body are sending pain signals through your spinal cord to your brain. SCS is designed to interrupt those pain signals using a small device called a stimulator and thin insulated wires called leads. The stimulator generates mild electrical pulses that travel through the leads to nerves in your back, interrupting the pain signals before you sense them. SCS systems can be programmed to deliver different types of therapies. Some therapies replace your pain with a soothing, tingling sensation. Others use a kind of stimulation you don't feel at all. With Boston Scientific's SCS systems, you get to choose which of these therapies works best for you. You can even switch from one to another or use multiple therapies at the same time. The ability to use more than one therapy simultaneously is unique to Boston Scientific's SCS systems and has been clinically proven to provide greater relief from pain. Boston Scientific's award-winning WaveWriter Alpha SCS system includes a therapy option designed to provide rapid and profound relief you'll start to feel immediately. And it can be used during everyday activities, including while you're driving or sleeping. A key benefit of SCS therapy is that you can try it out with a temporary trial system to see if it works for you. Your doctor positions the leads and connects them to an external stimulator that's worn around your waist. Then, for the next few days, you'll be able to experience what SCS feels like as you walk, sit, sleep, and get back to enjoying life. And getting back your life is what SCS therapy is all about. A recent clinical study found that patients using Boston Scientific's SCS therapies reported a greater improvement in their ability to do everyday activities than patients reported in other studies using non-Boston Scientific SCS systems. And with WaveWriter Alpha, you get the comfort of knowing your SCS system provides access to full-body MRIs should you ever need one. Boston Scientific provides a range of patient care services to help you before, during, and after your SCS procedure. You can connect with a patient ambassador, someone using spinal cord stimulation who volunteers to share their experience with SCS. Or contact one of our patient education specialists to answer any questions you may have. For additional support at your fingertips, download the MySCS app. Get on the path to personalized pain relief. Visit pain.com to find resources and learn more about safe, effective pain relief with Boston Scientific.
So what it alluded to there is just how flexible this system is with the WaveWriter Alpha. I think back to when I first started 15 years ago with the spinal cord stimulation in general. And basically it was a paresthesia system and it buzzed everywhere. You didn't have as much control. I mean, you had a lot less choices from a programming perspective. And now they can give you either paresthesia or paresthesia-free stimulation in multiple areas at the same time. And the type of stimulation, the paresthesia stimulation that you receive can vary greatly as well. They can make it kind of feel like a helicopter kind of sensation, as one patient described it to me, or a whooshing or waves, a variety of different types of programs. The paresthesia free is a nice option if you don't want to be feeling anything at that particular time. And then they have a remote control where you can change the type of symptoms you're feeling on the go or on the fly. And it can be different for different body areas, depending on what type of pain you're having there. So it's really come a long way. And I credit Boston Scientific for doing that. All right, next. So how do you know if so what we would do first, and one of the most remarkable things with spinal cord stimulation is that you actually get to try it before you buy it. In most things in medicine, it's you either had it or you didn't have it. If you have a spine surgery, you're at risk of having a lot of scar tissue. The mechanics of your spine may change, and it may create other issues down the road, like at the levels above and below a fusion, typically get worn out much faster. Whereas with spinal cord stimulation, you get to try it out for a week typically, see if it's going to help with your pain. And then at the end of that week-long trial, we pull everything out, nothing gets left behind. And then you tell us whether you liked it or not. So if you report at least 50% relief, although personally, I prefer if you like more than 50% relief. And if you're able to see other benefits to the trial, then, and you want to have it implanted, that's another important thing. We don't implant it even if you had 100% relief, if you don't want to have it implanted. Although hopefully we would have figured that out before you even went through the trial. However, if you're able to improve your activities, you don't need your medications, you're able to relax and sleep better, those types of things, secondary things, that really helps us know whether the trial worked for you. And then we'll go ahead and implant it. There's a couple of patient testimonials here. We'll go through the first, or go through them next.
When my son and I were out in Vegas, we had a lady pull out in front of us, and I slammed on my brakes as hard as I could. Fortunately, I was able to take the impact on my side of the car, which I'm sure helped him because he walked away perfectly fine. I couldn't work. I couldn't keep going to school like I was. My son and I had to move back with my parents. Changed a lot. After that, it was pain doctors left and right, pain management, injections. In the morning, woke up, took some pills, drove to work, take another set of 5 pills, and then right after work, and then at bedtime. It was hard for me to pick my son up. I actually had tears from the pain. He walked in my room and put his hand on my arm and said, "Are you okay, Daddy? Is there anything I can get you?" That's not how you want your child to see you. No parent would want to look like that in front of their kid. My doctor suggested trying the spinal cord stimulation. The trial, though, was great and seemed to really help. So as soon as I got in to get that out, I said, I want to do the actual implant. It was a realization that I wasn't going to have to walk around in pain all the time anymore. So after my parents were helping me for so long, I'm able to do the small things for them, you know, just cleaning up around the house, running errands for them, you know.
So, this is like a sun right here, and they're gonna be like different.
It changed my life. You know, I have everything back now. It's been one of the best decisions I've made in life, that's for sure. There's no more not being able to do this, or if I can do that, or if I should do that. Now it's more of, what can't I do?
Hi, I'm Mitch Sumi from Morsel, Indiana. This is my wife.
Sunita Sumi, also from Warsaw.
I've lived with my pain before we even got married. It's been over 20 years. I've tried a lot of different things to cure it. Nothing just seemed to work. It just kept getting worse.
I work on concrete and I lift a lot of heavy plants and move a lot of heavy things around. And it got to the point I couldn't even walk. We couldn't play with the grandkids anymore. You know, we just went to work and came home and became zombies, just sat here and did nothing.
I actually had a blow up mattress here on the floor. And that's where I would come and stay. Because the pain was so bad.
After trying many different things, Dr. Roth did suggest trying the Boston Scientific spinal cord stimulator.
When they did the trial thing, they do it in the office, and it's very simple. And as soon as I got it turned on and they set my device, I knew right then because my pain was gone. I mean, I haven't felt that way in years. So it was really nice to actually move without any pain. But the day of the actual implant,
Mitch is like, well, do it on her first so that you have practice before you do it on me. And so I did. I went in first, and then he had his. So we got done, came home. A couple of days later, he decided to go to work.
started our new life. I mean, it's nice after we had this done that you could actually pick up your grandkids.
The little 1-year-old, we can keep up with her now. They want you to play ball, and they want us out there when they're on their swing sets or on their toys. And so we can actually do that now with them. And it's been so nice.
I know I keep saying it's a miracle, but this thing is just unreal.
Our life's so much easier. We do laugh a lot more than we used to, you know.
A better life.
Yeah.
Yeah, those are very real stories. You see patients like that coming through our clinic, and it just the impact that and change they can have on somebody's life. What I like about spinal cord stimulators and Vertiflex and radiofrequency is how much it can change people's lives, and so rapidly. So if you have any additional questions, I'll stay on and take questions. You can also go to pain.com. It has an excellent resource and further information about what we just talked about tonight. Next slide. And here's my contact information, as well as my partner, Robert Heros. We're here to see patients. We also have a physician assistant, Tyler Huntington, and a nurse practitioner, Margaret Baker. And we all do evaluations of new patients and see patients and follow up. But we'd be happy to talk to you about these types of options.
Thank you, Dr. Anderson. Those videos get me every time. I see them. I've seen them several times, and I swear every time I just love hearing about those stories because it reminds me of the patients in our office that I've heard the same thing from. So please welcome Lee from Boston Scientific. She is going to be running the Q&A section of this webinar this evening. So take it away, Lee.
All right, thank you, Liz, and Dr. Anderson, thank you so much for such a wonderful presentation. We'll go ahead and get started with the Q&A. So if any of you have any questions, go ahead and pop them in the Q&A box. It should be at the top or the bottom of your screen. And I will take it away here. So the first question we have, Dr. Anderson, is, does the spinal cord stimulator work with chronic thoracic pain?
So It can, yes. There are a couple of different ways we can treat that with stimulation. But it can help with chronic thoracic pain as well. Traditionally, it helped with neck generated arm pain and low back generated leg pain. That was the initial indication for it when I first came into this field. But as you saw in this presentation, it's now able to address back pain. Traditionally, it's more directed towards low back pain because there's a lot more patients with low back pain. But we could definitely talk about it for chronic thoracic pain as well.
Thank you. I also had a question about for cervical for both of the Vertiflex and SCS therapy.
So for Vertiflex, it's only indicated for the L1-2 down to the L4-5 level. So just in the low back levels. It is not indicated in the neck at all. The way the anatomy is in the neck, it wouldn't probably last there. You'd have to try a different solution. As far as spinal cord stimulators, yes, I have done spinal cord stimulation trials and implants for the neck. And again, it was traditionally used for arm symptoms. But again, the technology has advanced so much that we could entertain it for the neck, although we might try radiofrequency ablation first if it hasn't already been tried, because that's more common for neck pain. But yeah, we could evaluate you for that.
Thank you. Next question is regarding paresthesia. What is paresthesia?
So paresthesia, one way to think of it is it's a pleasant massage type sensation when it's used in spinal cord stimulation. But it's any kind of sensation that you feel that can be like a buzzing sensation. That's kind of how I think of it, is kind of like a buzzing sensation or a pleasant massage kind of sensation.
Wonderful, thank you. What is the downtime for Vertiflex? And while we're on that, what is the downtime for SCS as well?
Okay, well, I think for both of them, if you have them implanted, is 6 weeks of no excessive bending, lifting, or twisting. Basically, we don't want you to lift more than 10 pounds, or what would be for some patients, it's 5 pounds, because, you know, to lift 10 pounds is a huge exertion for them. But in general, we say no more than 10 pounds for 6 weeks and no excessive bending, lifting, or twisting, so that the leads or the device, the Vertiflex device, will stay in place.
Wonderful. And the next question I have here is, are these devices MRI compatible?
Yes, that's the quick and short answer. For the spinal cord stimulator, they are, although they may have to use a couple different modes than they normally would, but you can have whole body MRI now.
Great, thank you. The next question that I have here is, how often can I get radiofrequency ablation? And, oh, no, excuse me, that was just it.
Okay, so radiofrequency ablation, you have to wait a minimum of 6 months before it can be repeated. And with the way the Medicare works, the new rules, as long as it's done within 2 years of the time that the first radiofrequency was done, you don't have to go through the testing process again to prove that, yes, that is the source of your pain. So minimum of 6 months. And as long as it's done within 2 years, although I've had some patients come back many years later, and they want to be seen for something completely different, and they're still having relief in the area I treated before. But they're kind of more outliers.
Okay, thank you. This one doesn't specify which device they're referring to, but the question is, what does the implant look like and how large is it? Also, does it interfere with any normal movements?
Okay, so this is what the implant, this is a plastic version of the implant of the Vertiflex device. The incision is actually a little over an inch maybe. for this device. I use a dilator to put the device in. The purple part that you see here is actually folded forward when the device is put in. And then if you're familiar with drywall screws, this is basically a repurposed drywall screw in some ways, in that there's a part for a screwdriver-like mechanism device that I use to open this up and deploy it, and then I tap it forward with a hammer. So very small. This is about 1 centimeter tall. Yeah, very small. Now, as far as a spinal cord stimulator, it has 2 different parts to it. It has the leads that we use, which are kind of like spaghetti in diameter, and they can be varying lengths depending on how far we need to travel with them. And then the generator is depending on what type of generator you get. The biggest would probably be about this size. You put your finger over your thumb and your index finger. That's probably about the size of one of the bigger generators with a permanent battery where you don't need to charge it all the time, to very, very tiny for the rechargeables.
Wonderful, thank you. I've got quite a few questions here regarding different activities, and after getting it, there's no specification as far as SCS or Vertiflex, so we can just answer both if you will. For different activities such as yoga, riding horses, and playing golf.
Yeah, I mean, I think if you you observe the 6 weeks of no excessive bending, lifting, and twisting with Vertiflex, we like to get you into a physical therapy program following that 6 weeks to help counteract all the effects of sitting, prolonged periods of time sitting. Also to help, now that you're going to want to be able to do more activities, you may have been deconditioned, as we call it, where you just don't have enough stamina to go do those activities. So we want to get you into physical therapy to build up your stamina, and also to help kind of stretch out the hip and the low back, and get the best outcome for you. Basically, if you've been bending forward for long periods of time, the muscles start getting short in your hips. So we need to straighten you back out again with physical therapy. So once you conclude physical therapy, which is another 6 weeks, you can get back out there and doing regular activities, maybe even before then. With a spinal cord stimulator, if you're super active, okay, like you wanted to go back out on the tour to play golf, you might want to wait a little bit longer to allow the leads to scar in. But if your activities are more weekend warrior, you probably could get away with, waiting for that 6 weeks of restrictions, and then start going out and testing it out.
Great. Next question I have here is, how soon can I drive after the procedure?
So good question. So the spinal cord stimulator has an indication where you're supposed to have the device off when you're driving. I think that's more to protect them legally, so that, if they don't want to be blamed for an accident, basically. They don't want you to say, oh, I got zapped by my stimulator and it caused me to hit the accelerator and crash. So you're not supposed to technically drive with the spinal cord stimulator on. As far as the Vertiflex procedure, after a day or two after this anesthesia wears off, you could start driving again. And probably similar for the spinal cord stimulator, as long as you're okay driving around with a wound on your back, because the first 2 weeks you're going to have staples in your back. So once you're feeling comfortable enough, you could go out and drive again.
Great. The next question I have here is, if anesthesia is required for a replacement of these devices.
So I have done both of these procedures with and without sedation. I've done the Vertiflex procedure probably about 5 times with no sedation at all. It can be done. I know where to numb or place the numbing medication so that it's not painful. And each time the patients have smiled and said, it went great. So it may sound barbaric, but they actually did very well. As far as the spinal cord stimulator, I've done that also with no sedation. It may be a little bit uncomfortable at times, but yeah, you don't have to have sedation. Some patients just from a medical standpoint can't have it, or they don't want it. They've had bad experiences with sedation in the past. So typically though, most people elect to have sedation for these procedures, and we can accommodate that.
Great. I've had some questions regarding SCS and the advancements that have taken place in the last 10 years that you've mentioned. And the questions have been, when should I get, or would it be best if I would get an upgraded battery?
So it really depends on, one, is your current therapy working for you? And if it is, I wouldn't change anything unless the generator has reached end of life. Because sometimes for some patients, if it's working for you, that's the biggest thing. We want it to work for you and work well for you. If it's not working well for you and your stimulator is, again, it's probably going to be a few years old at this point, we can look and see how much longer it's designed to last, and talk about replacing it if we need to.
Great. The next question that I had was about if a patient has been or had a fusion, are they able to get any of these procedures done?
Yes, absolutely. The spinal cord stimulator, we actually place above where they typically do fusions, which is down the lower back. We usually can go above that to get the spinal cord stimulator leads up to where we want them, which is usually about the level of your shoulder blades within the spinal canal. As far as the Vertiflex, yes, it can be placed as long as you have a spinous process, which is one of these bumps back here. I have placed one adjacent to a fuse level. Let's say L4-5 here is fused. I have placed one at L3-4. As long as the spinous process is there. Sometimes they fuse and take out the spinous process. And in that case, I don't have anything to counter force attach the device to, basically. So it won't work in that situation.
Wonderful. And the next question is, do I need to carry some sort of external device with me for SCS?
So during the trial is the only time that you have an external device that you're going to carry with you. It does come with a remote control, and you can elect to bring it with you or not. Some patients get on a great program that they really like, and they just throw the remote control in the drawer and just don't even bother with adjusting it further. So it really depends on your comfort level with the therapy and whether you want to. I have some patients who really like to get it into the therapy and like to adjust it, and they really like to have a lot of programs and play around with it all the time. I have other patients that they just want it to work and it works for them, so they put the remote control in the drawer. So what I like about the Boston Scientific product is that it has so many different options and it can suit both types of patients very well.
Great. The next question is, I guess the question would be, does Vertiflex also need to be replaced? And then following that, are either of these devices reversible?
That's a good question. So the Vertiflex device does not need to be replaced. let's see, I've placed probably about 50 of these, and I've replaced one of them because I initially had wanted to put in 2 of them, and I couldn't put in a second one, but I had downsized the first one in anticipation of putting a second one next to it. When that didn't give enough relief in that configuration, the patient asked that I put in a bigger one. So that's what I did. So yes, they can be, this can be taken out. Just go in, unscrew it, and then it can be pulled out, and then I can put in a new one or just take it out altogether. If a spine surgeon had to go in there and do spine surgery, again, they would consider your back a virgin spine when they went in there, and they could probably pop this device out within 30 seconds to a minute on their way to doing the surgery that they want to do, because they are going to be taking away some of the bone that's helping to hold it in there.
Wonderful, thank you. Another question we have here is just about quality of life again after the implant, specifically SCS. Do you go back to your normal life, or will there be any sort of physical limiting factors after you get it implanted?
No, I mean, so first of all, spinal cord stimulators are not necessarily a cure. They're a non-pharmacologic way to help deal with your pain. So you still may have some level of pain or discomfort at times. But yeah, there's really no limitations unless you're extremely active, and like the analogy I gave with, like a Tiger Woods, for instance, you may have more issues there, or we could potentially have a surgeon implant the spinal cord stimulator to really get it locked in there and keep it from moving. But no, you can get back on with your life.
Perfect. The next question we have here is just confirming that for SCS, that is in fact a battery that is implanted, and then also how does it get charged?
Sure. So there's actually 2 types of, we call them generators, okay, or implantable pulse generators, IPGs, which has the battery component as well as the computer component of the device. And they also have wireless transmitters so they can interact with your remote controls. But there are 2 major types. There are what we call permanent generators, where you don't have to recharge them, but when they die, then we replace them. So it's just a small incision over where the generator sits under the skin. The body creates kind of a pocket around it. It's not very deep. It's just an incision. We pop the old generator out. We hook up a new generator, the latest, greatest at that time, and then put it back in and sew everything up. The other option is to is a rechargeable generator. So in that case, you may have to recharge it every few days or every day or once a week, depending on how much energy you require to get relief from your pain and discomfort. So those typically last over a decade. And you just recharge it typically for about a half hour or an hour at a time, depending on how long it's been between charges. And a lot of patients just do that sitting, watching TV or reading.
Great, thank you. Another question here is regarding traveling, and are there any problems with flying with SCS?
So no, and same goes for the Vertiflex procedure. I have had TSA agents come in either as patients or family members, and I always like to ask them, is this going to keep one of my patients from, getting on the plane, or are they going to be held up? Are they going to be strip searched? And every single time the answer is no, we see these things all the time. So Really, no, I've yet to have a patient come back and say, I want this thing out. Every time I go to travel, they're strip searching me or they're holding me up. Nobody's said anything like that.
Great. Okay, Dr. Anderson, I think that wraps up our Q&A. We do have quite a few more questions that are a little bit more specific and would require seeing Dr. Anderson to get the full scope of your personal situation. So I will just pass it back off to Liz, and we'll definitely be able to connect you with Dr. Anderson if you'd like to learn more about those. So I apologize, we can't get into those more specific questions, but passing it back off to you, Liz. And Dr. Anderson, thank you so much for your time this evening, as well as you, Liz. Thank you.
Yeah, there were so many good questions, and there's so many questions. I'm so sorry we don't have enough time to get through all of them, but we will be reaching out to patients tomorrow for follow-up. Just so you're aware, just because we couldn't get to your question tonight doesn't mean it won't get answered. I really appreciate your time tonight and joining us. I hope you feel like you got some education this evening about your pain treatment options. Again, if you have any other questions, we'll definitely be in touch with you. Please also feel free to contact our office during our regular business hours to schedule a consultation. We are open from 8:30 to 5, so don't call tonight. But the phone number is on the screen, 503-885-1515. You can also request an appointment online at spinaldx.com at any time. Thank you again so much for joining us. If anybody's traveling tonight, stay safe. The roads are crazy. And thank you again, Dr. Anderson.
Thank you, everyone. Thanks for attending. And we look forward to seeing you in the office soon. Good night.